Everyone. I hope everyone is having a good Wednesday afternoon. So I am doing another live session this lunchtime, and I'm going to be doing it on managing prescribing risks today. So I hope everyone's day is going well, and that everyone's coping with the thunderstorms and rain that we've had over the last couple of days. But thank you for everyone who voted in the poll. So I put a poll up a couple of weeks ago just with regards to the topic that you'd like me to kind of discuss in my live session, and this came. This was definitely the highest that everyone had voted for. So thank you to everyone for voting for that. So I'm going to be spending the next kind of half hour talking about managing prescribing risks. I've received a lot of questions about this since I announced that I'd be talking about it live. I've basically been through all of the questions and just put some information together that I'll kind of just discuss with you guys with regards to the way I see managing prescribing risks. If you have any other kind of specific questions, please feel free to put them in the comments, and I will try and address them as I kind of go through the session. So I think most of you guys have expressed an interest in kind of understanding a bit more about this because the GPHC published some information, I think it was a couple of months ago now, with regards to an increase in fitness to practice cases. And this was disproportionate for pharmacists that worked in kind of online pharmacies and that were prescribers and prescribed for patients online. So I'm definitely going to address that from the prescriber's perspective today. And I know that there's quite a few pharmacies that have kind of reached out to me and asked me to do kind of a, so to speak, mock inspection in order for them to understand their kind of organizational risks. And I'm kind of doing those over the coming months as well. So thank you, all of you who've reached out to do that. So prescribing is obviously a high risk activity. So it's a high risk activity for anyone. So for our medic colleagues, our nursing colleagues and our pharmacist colleagues. For pharmacists in particular, it's deemed as higher risk because we're not used to making those decisions that are associated with prescribing. And our kind of day-to-day practice doesn't really lend itself to gathering all of the relevant information to be able to make that clinical decision. And quite often our kind of day-to-day practice means that when we need to make that clinical decision, we usually pass it off to someone else. So we pass it off onto kind of a medic colleague or a nursing colleague or someone else basically in order to make that kind of clinical decision. So it's kind of almost like we need an adjustment in our mindset as pharmacists, as healthcare professionals, in order to make that judgment in a safe and rational way. Now, pharmacists, as kind of a professional group, we're quite logical and we're quite rational. So we definitely have the skills to be able to prescribe safely. I would argue that actually we're probably the best prescribers because we have all the knowledge about kind of the way that medicines work, and things like concordance, and getting the practical aspects of medication sorted with our patients. So I would argue actually we're much better at prescribing, but obviously I'm a pharmacist, so I'm quite biased. I think that documentation is incredibly important, and I would ensure that when you're prescribing that you have a clear audit trail of documentation which outlines a clear history, so helps you to identify or someone else to identify if they're auditing what the history of this patient is, what your rationale for any decision making is. So, for example, if you decided to prescribe X, Y, or Z on a particular occasion, then to ensure that you have that rationale clearly documented. It may not be obvious to everyone. So, you may be sitting there thinking, okay, well, it's really obvious I should prescribe for this patient in this particular instance, but it may not be obvious to everyone. And, I would just make sure that you've documented that rationale in there, particularly if it's a decision that maybe is unusual or means that you have to make a clinical judgment. Maybe it's not quite within the realm of guidelines, or maybe there's something that you have to really consider and be quite patient-centered about. I would definitely make sure that you've documented that rationale there as well. Okay, what else do I want to say? It's super important to be able to reconcile the patient's history. So, is this a patient that you've kind of seen before? Are you the primary care provider for this patient? So that has a huge impact on whether it would be safe for you to prescribe for this patient. Obviously, for the NHS provider, example, you will be the primary care provider. You'll have access to hopefully the patient's full medical record, and that means that you'll be able to reconcile most of the information that the patient has presented to you. But there will be instances even in that case where you may not be able to reconcile information. So, for example, discharge letters. It may be that the patient is newly registered with you. It may be that the patient is from abroad, is newly registered within the NHS, and maybe we don't have a full history for that reason. So it is really important to kind of try and reconcile that history. And if you're not able to, then to document again really clearly. So where did you get this history from? What is the history? Do you have anything to verify this history for this patient? It's super important when you're also prescribing to ensure things like the basics are in place. So, for example, are they taking any other medications? Do they have any allergies? Again, when you're working for kind of a traditional GP practice and you've got access to their full medical record, that's much easier than actually if you're working in an online pharmacy. You may not have access to all of that information. So that's just something that you kind of need to bear in mind. The other thing that I kind of wanted to touch upon really is organizational risk. So obviously, as a prescriber, you're not responsible, you're not expected to mitigate the organizational risks, but your organization will hopefully be looking at the overarching risks for patients when we prescribe for them, and setting processes and things in place. It's really important to ensure that you know what those processes are and that you're following them, because that would put you at risk as a prescriber and may affect your indemnity if you're not following those particular processes. I think the other important thing, and so I'm looking at this very much from the perspective of an inspector or an ex-inspector, and also someone who's managed organizational risk for prescribing for a very large organization previously. And it's really important to understand that the information that you have about the patient is accurate, is the patient is who they say they are, and that could actually happen both in the online and the face-to-face world, because you don't actually know what your patients look like, do you? Just ensure that the information that the patient has provided you with is accurate, because actually that will open both a prescriber and an organization up to risk. There's obviously going to be patients who try and abuse or misuse the system, but we obviously need to do everything we can to kind of minimize those risks to the organization and to the prescriber. Now, if I putting myself again in an inspector's shoes, if I was interviewing, for example, a pharmacist within, I don't know, an online pharmacy, and actually kind of trying to understand about the ways that they mitigate risks of prescribing, I would want them to have an overarching understanding of the way that the organization mitigates risk. And I would look at potentially detail like, is how do I know that the patient in front of me is the patient that they say they are? For example, like, how is ID verified? How am I communicating with the patient? What ways are there that this patient could be misusing? So, like, have we tried to bridge any of those gaps? I would also look at kind of just the general process end to end. So I would ask the pharmacist prescriber, for example, to talk me through what they do if there is an issue. So what would they do if they weren't sure about whether to prescribe for a particular patient or not? Who do they go for support? What is within their scope? So I'd want their scope to be very clearly defined. What kind of CPD do they have to enable them to prescribe in this particular area? So I'd probably go into that level of detail in an inspection. I think that also risks are associated with the types of medicines that you're prescribing as well. So I think that's really important to consider. So, for example, for me, something that would be super high risk is something that's being prescribed online and something that's either an injectable or a control drug. So in my spectrum of risk, that would be at the higher end of the spectrum. So something that's injectable, so things like Saxenda are coming to mind, which is quite popular in prescribing in online pharmacies. That's super high risk because it's injectable and also available online. But also controlled drugs, obviously they're open for misuse and abuse. And if we don't know that the patient that we're speaking to or the patient that we're consulting with is genuine, then we're opening ourselves up to risk. So I think that's super important as well. Just understanding what types of medicines that you'll be prescribing, why you're prescribing them, and what kind of arena you're prescribing them in. So are you seeing the patient face to face? For example, with Saxenda, will you be weighing them? Will you be checking their understanding of how to use the product? What do you do if they have some kind of allergic reaction or some kind of adverse effect to injecting the Saxenda if they've used it for the first time, for example? How would you mitigate for that risk? Like, I'd want to understand that as a prescriber prescribing in, for example, an online area, that you've thought about those risks and there's ways to manage them. I would also document refusal of prescribing. I think we're all very focused on obviously the act of prescribing, but actually it's super important to demonstrate clinical governance processes that actually there are situations where I will refuse to prescribe. And again, I would document the rationale, have a clear history, have a clear documentation of the kind of discussion, and have a clear plan of how to ensure that the patient receives the care that they provide. So it might be that actually it's more appropriate for a GP in this instance to prescribe this medication. It might be more appropriate for a primary care provider to prescribe the medication in this particular instance. It might be that this medication is not appropriate for this patient at all. So going back to the Saxenda example, their BMI may not be in a range that's suitable to prescribe the Saxenda, and that's why you've refused and declined to prescribe, and providing the patient with that counselling and if necessary signposting them for help and support. So that's super important as well. So I've covered documentation, I've covered organisational risks. I think it's super important, I've touched upon it already, to ensure that you keep up to date with your CPD, and keep up to date with, document that you're keeping up to date with the area of scope that you're prescribing in. That's really, really important. It may not be inspected, so it may not actually be checked by someone, but you don't want to be in a situation where there's been an update in the area of scope, and actually you're not up to date with that, and you're maybe prescribing something that's inappropriate or not in line with guidelines. So I think that's really important for you to do. I think it's really important also for non-medical prescribers to have an adequate support network. So before you start to prescribe, it's useful to kind of understand who you can go to for support. A lot of pharmacist prescribers are quite new to the prescribing world, and may just want to sense check decisions with someone. And it's useful to kind of understand who it is that you can do that with, in what capacity you can do that. So for example, do you have a catch up with, I don't know, a senior pharmacist prescriber once a week, where you can bounce off ideas and go through cases that maybe you weren't quite sure about? Is there something else that you can do to help get support? Is there an online kind of chat mechanism in your GP practice? Is there someone you can just call whenever you need to? I think you'd be fortunate if you were able to do that, but is there someone that you can just pick up the phone to and just call if you weren't sure about a particular decision? So that's super important to do. One thing I also just wanted to kind of touch upon was clinical supervision. So if you are not a medical prescriber, I would strongly suggest that you engage in what we call clinical supervision. Now, the name kind of suggests that you're basically supervised during your practice, but actually that's not the case. Clinical supervision is basically an activity that you carry out with a accredited supervisor. So I used to do this in my previous workplace all the time, for example, and you can do this as a group, or you can do this individually. But basically what we'd do is we'd ask the prescriber to bring a case to a session with them. That can either be individual or in a group. And during this case, we asked them to, it's got to be something that basically didn't sit comfortably with them. So, they weren't able to make a decision in the way that they wanted to, or maybe there was something that they didn't feel was quite right, or they found it difficult to be able to consult with a particular patient. So they bring this case to either a group or individual supervision session, and the supervisor would then help them to reflect on that particular case. So as an example, I'd ask them questions about kind of how they felt during the case. Was there anything in particular that they were unsure about during this particular case? Was it the way that they spoke to? Was it a difficult discussion because they didn't have the knowledge or the skills? Or was it just a difficult discussion because it was a sensitive topic? Or was it that they weren't up to date with guidelines, etc.? All of the clinical supervision sessions that I've done have been super, super helpful, both for myself as a supervisor, but I've had lots of feedback from other attendees that actually they found it particularly helpful. So if you don't have that set up and you're a pharmacist prescriber, then please feel free to reach out, and I'm happy to help you set something like that up in your practice. But that's super, super important. I think it's also, particularly with the group supervision sessions, it also helps you to identify gaps much more proactively, and also help you to learn as a group and learn and develop as a group. So I find that super, super useful, which is really good. Okay, brilliant. Let me just check and see if there are any comments or questions. I can't see any at the moment. If you bear with me, I will just check if there are any questions anywhere else. For some reason, it doesn't show me questions on Facebook, so I'm just going to have a quick look. I can't see any there right now. Okay, no problem. I will just continue talking. Okay. So I've got one here. So Abdul Alvi, I think, for private prescribing, how can we know info given by patient is accurate if no access to SCR, maybe no consent to contact GP? So Abdul, kind of what I was alluding to, maybe I wasn't very clear earlier, is I would ensure that you have a general understanding of the way that patients engage with the service that you're working in. So, for example, if I can just go on to an online pharmacy website and put in any details, they're not verified in any way. So, for example, I could just make up an email address, put it in there. You don't verify my ID in any way. You don't check any other details. You don't check if, I don't know, maybe you have an NHS number or something, anything like that. If those details are not validated in any way, then it's unlikely that your organisation is actually checking robustly that the patient that you have in front of you, or that you're consulting with in whatever way you are, is the patient, is a genuine patient. But even in that instance, you'll have a proportion of patients that are genuine, but there will still be a group of people that will be trying to abuse that system. And the less checks your organization has in place, the more likely it is that actually people like that will slip through. And even though it's the kind of organization's responsibility to ensure that that pathway is robust, you're still responsible for any of the prescribing decisions that you make. So if you have a prescription kind of in front, a potential prescription in front of you, and you've prescribed and you don't know that that person's genuine, and the organization hasn't kind of checked robustly, then it would still be your decision. It would still be your kind of decision as a prescriber, and that could potentially lead to some kind of action against you if it led to that. So I think as an ex-inspector, I probably wouldn't buy that you were unsure of the processes. I think I'd expect it to be your responsibility to go away and have an understanding of the way that patients engage with the service, the way that things like ID, age, locations. How do you know that you're not prescribing to patients in, I don't know, random countries or whatever? So I would just ensure that you've got a general understanding of that. I don't think you need to have an intimate understanding, but you just need to have a general understanding of, yes, we use a system to check the patient's passport. That's then verified using a selfie. So that's quite a common way to check ID of a patient. Their email address is also verified. And then we do X, Y, Z checks at every point. We also inform the patient's GP and whenever we prescribe. So that's part of the service. It's really just having an understanding of the full pathway, and then understanding whether the risks are mitigated enough. So, for example, if there was no ID check in place, no way of verifying the patient is who they are, there is no way I'd be prescribing something like Saxenda. It just wouldn't happen. So it's worth just having a think about, so what group of medications am I prescribing? And is this, is the mitigation of risk proportionate to what I am prescribing at this particular point? I hope that helps. Please feel free to reach out for any reason if it doesn't. I can't see any other questions right now. Let me just have a quick look on Facebook again. Bear with me 1 second whilst I do that. Okay, lovely. Can't see anything on there. Okay, I will continue talking for a few minutes then. So been through kind of your documentation and kind of the organizational risks presented, a bit about training, a bit about kind of clinical supervision. I think that most of the stuff that I've kind of spoken about might kind of scare you into not making those prescribing decisions. And actually, that's not what I want at all. I think, like I said at the kind of beginning of the session, I think that pharmacists are really well placed to be able to make prescribing decisions. We have a brilliant set of knowledge and skills in order to kind of prescribe quite safely. I think it's just a case of understanding the way that you approach making that decision. And I'd love to see many more pharmacists making those kinds of prescribing decisions and using their clinical judgment and actually making independent clinical decisions. I don't think that as a group we do that enough. So I'd love to see that much more. I think it's just a case of making sure that your processes are robust enough to ensure that you are mitigating the risks and prescribing as safely as possible. So hopefully the session that I've done with you today will give you a bit of a flavour as to some of the things that you kind of need to watch out for. For myself, I'm coming up to the time of year where I need to revalidate and I'll be doing my CPD entries. And one of those is a peer discussion, for example, and a reflective account. So that's a really useful tool just to be able to kind of understand, like reflect, take a step back, think about, okay, so what am I doing? What am I doing well, and where do I kind of need to improve? So I think that's a good, a useful kind of time to do that. And I realise that we all kind of revalidate at different times of the year now, but that's a useful thing to do. I was going to say that if anyone would like a bit more information on some of the stuff that I've kind of talked about, so I appreciate that I've condensed it quite a lot and may have introduced some quite abstract concepts. So I'm happy to kind of talk through a little further if you'd like. I am offering one-to-ones with people over the next few weeks. I checked just before the session and there's a few slots left. So if you would like to, I'll pop the link at the bottom of this live session so that you're able to kind of book into that. I expect those slots will be booked up quite quickly. So please don't wait around if you'd like to book in a one-to-one. Unfortunately, it's a limited offer just because I'm taking a short break from doing some work. So please take advantage if there's something in the live that has interested you. Okay, brilliant. I will draw to a close then. Thank you so much to everyone who's attended. And I hope many more of you will watch this recorded session. And please feel free to reach out if you've got any comments or questions, if you weren't able to make it live. If there is a better time for me to do a live for you guys, then please let me know. So please just drop me a message, or I might do a poll actually, just to get you guys' thoughts. So I've been doing lunch times for the last few lives that I've done, so I may kind of switch it around and do, I don't know, evenings or maybe even weekends or something going forward. Please let me know what suits you guys best. But yeah, I will send that link for you guys, and Mohammed, yes, I'll send the link for you in a minute. But yeah, thank you everyone, and have a lovely day.